It's one of those issues that I think a lot of people don't pay attention to and wouldn't think would be that important. Unfortunately, every year we see anywhere between 30 and 50 young children admitted to the hospital at Harborview for treatment of injuries after they've fallen out of a window. When the weather gets warm, people compensate by opening the windows and letting natural breezes come through the house. So we see a very clear correlation between the temperature outside and the number of window fall cases that we're admitting here at Harborview. So the peak is always in the summer months and typically starts just after the first warm weekend. I think there are a number of things you can do. The first thing, and probably the most important, is really for parents and caregivers to recognize that an open window is a danger to toddlers, even if there's a screen there. Maybe especially if there's a screen there, because a screen gives a false sense of confidence that somehow or other no one's going to fall through that. Insect screens are designed to pop out. They're meant to be a way for you to escape a fire in your house. And so they do not typically support the weight of a curious toddler leaning against them. There are window stops that you can install that will limit the opening of your window. If you have double hung windows, you could open the top window rather than the bottom. We talk about supervision. Of course, we want parents to supervise their children carefully at all times. But most parents who experience a window fall are supervising their children well enough. They're not negligent. The kid just surprises them by leaning against a window screen and disappearing out the wall. Probably the best advice for parents is to act as you would act if you had no screen on your window. Right? If your window were open and there was no screen on it, would you feel safe leaving your toddler alone in that room? Would you feel safe letting them play on the windowsill? I think for most parents the answer would be no.